Foley. I've worked in the area of child protection really since about the 70s, when I started working with children and families who needed help and support. Some of them were in hospital, some of them were before the children's court, some of them were families where there was serious illness and they needed some support. And I've also worked in a number of different organisations. So I worked, as I said, for health, and I worked in hospitals. I worked in non-government organisations running group homes for teenagers. And then I worked in what was then called a child guidance clinic. I think it's now community health, in Sydney. And in that area, I saw lots of families who were struggling with their children, some of whom were children who were adopted, some of them were children who had mental health problems or developmental problems. So my job was to do family therapy with them. I then went to work in the Department of Psychological Medicine, which was where there were many children with quite significant problems and their families. And my job there was mostly to work with the children who'd been affected by abuse or who'd experienced the domestic violence of their families. During that time, I also worked as a clinician for what was the newly established Children's Court Clinic. In 2015, I left psychological medicine and I was appointed to be the director of the Children's Court Clinic, because I have a great passion for looking after the well-being of children, but also for empowering parents to change and understand how they could be the best parents they could be.